You can have an appointment, but it's going to be in a couple days. And most of people, when you want an appointment, it's like right now. You learn that you were in contact with someone with COVID, so you do want it now.
Another record day of new COVID-19 cases in Quebec, with more than 14,000 reported Thursday, as many of Quebec's COVID-19 testing sites, like this one, continue to be pushed to their limits. And the lines may have grown even more because Quebec's online platform to make an appointment for a test was down for almost a day, resulting in more people lining up at walk-ins and waiting hours, possibly deterring others from getting a test, leaving case counts underreported.
We really have a gross underestimate of what is actually going on in our community. But even based on those gross underestimates, the hard metric is that we're seeing hospitalizations. And so whether that's going in through a PCR test or a rapid positive test, people are getting infected and they are landing up in the hospital.
Hospitalizations in Quebec surging towards 1,000, and Quebec's Public Health Institute is projecting 1,600 to 2,100 hospital beds could be occupied due to COVID-19 in the next 3 weeks.
Lockdowns with curfew do dramatically decrease transmission. And the question is, do we need to do that now? It would be nice to say that we don't. None of us want any of this, but, there may really be no alternative in the short term.
The Quebec Health Ministry notes only people experiencing symptoms of COVID-19 and who do not have access to rapid tests should visit a testing center.
Yesterday, my parents went to the Hotel Dieu, but there was supposedly like a whole thing with the system went down, and that's why when they went there were people in line still from their 11 o'clock appointment. So they made an appointment there, and they were like, no, I can't do this. I'm not waiting 3 hours for my appointment.
And they're going to ask you, even if you're in the sans rendezvous with no appointment line, they're still going to triage you if you have 2 positive rapid tests done already, or you're very symptomatic, or you're a healthcare worker. If you're not any of the above, you're still going to either wait 5 hours or be sent home.
Montrealer Olivier Drouin, who has been tracking COVID-19 cases in schools for more than a year, added to his platform on covidécolequebec.org for individuals to self-report their positive rapid tests, whether in school or the general population.
Parents were told by the government there's so many cases we cannot detect anymore or test anymore. So if you have a positive case, assume that it's positive and just stay home. But the problems was that these positive cases were what I called orphans. So they were not declared officially by the government. So you had thousands of people that are orphans. They have a positive diagnostic that nobody knows about.
As Quebec is reporting a 28% positivity rate in their testing, experts are calling for reinforcements.
We are where we are now. And where we are now is that the pace of the virus is outrunning the pace of our protective measures. So then we have to ask ourselves, well, then do we augment or enhance our protective measures?
In Montreal, Felisha Adam, City News.